first panel about the importance of high-quality, accessible health care. At the same time, we'll never be able to achieve it in Hawaii if we lack the workforce to deliver it. Do any of you have any idea how many nurses currently are licensed to practice in Hawaii? We have about 10,000 nurses, and on any given day, we are short almost 1,000 nurses. So it's very critical that we have the nurses we need, and Hawaii is very fortunate in that there are more people wanting to go into nursing than we can accommodate. So we turn away about 75 qualified applicants at my program alone each year because we don't have the spaces to educate them. At the same time, you're short almost 1,000 nurses every single day. We're also an aging workforce, like most of you here. Less than 10% of the nurses in Hawaii today are under the age of 30 years. Most of them are my age or older, who came into the profession in the 70s, and we're looking to get out. We're ready to retire. Our backs have given out. We're tired. We've been caring for people for a long time. That's taken its toll. So within the next 10 years or so, you're actually going to be short 30% of the projected workforce that is needed. And yet here we are with people who want to come in and be nurses and stay in Hawaii. We reflect, in some ways, a national shortage, and there are states where the shortage is much worse. So in the last 2 years, we're actually seeing recruiters come in from other states to take away our nurses and our graduates. And so where about 90% of the UH graduates used to remain in Hawaii, we're starting to see that number decrease. So we're very committed to helping our graduates stay
where you have this strange high deductible, and then you get insurance for this amount of time, and then you get this donut hole or something where there's no payment, and then you get your catastrophic. And the result of that is we owe HMSA 300 grand, and we ain't paying it. We're not paying it until HMSA can show us where in that bill that they sent us is the donut hole that we're filling in with our funds, and where Medicare is paying. And HMSA, I'm sure, wants its money, and has been working for, what, over a year to figure out how they can back up the bill to us. And I don't know how much that costs them. It didn't cost us too much yet. Because we just say no. Okay? But they're out the money. And we know we owe them the money, I think. When you give us the backup, we'll tell you if we owe you the money. But they can't give us the backup because it's a crazy system. It is not. This country has a crazy patchwork system that's totally inefficient about its delivery of medical services, and it creates a huge problem for workers.
The consumer I represent normally is the first one that's going to be tapped, the first one that's going to lose the service, and that's our poor community, the indigent of Hawaii. And I represent the North Shore. I come out of Ha'ula, where per capita ranks right there. Used to be level with Lanai, but I heard Lanai now is higher than Ha'ula. And so, I represent one of the lowest income areas in our state. And we have a struggling medical system there. We all know the situation with Ha'ula Hospital, and that makes a big impact on Ho'olauloa at this time. And I cannot see going without that very system. A lot of our community depend on the system. I like to train them, I like to teach them and educate them that primary health care is far more important. But unfortunately, our people out on the North Shore use the system when they're hurting the most, when they get in accidents, or when they're forced to use the emergency room. And that's some of the areas where I believe primary health care can help our community. And that's in the future, but in the meantime, our community is suffering. And with all the emergencies we're hearing and all the excitement that's happening, I believe the first one that's going to be services is our poor. So I think now is that time, and I thank FACE again for giving us this opportunity that we can start to focus on, again, the advocacy. We all have to stand together. We got to be that one voice to help fix the system. the broken system. I hear the cries. I attended many funerals. I believe didn't really need to take place. A lot of people don't get out the services they need, and by the time they get it, it's too late. And by the time they do go in, it's costly. And then when they leave, the family is stuck with the bill. And that goes on and it goes on. So we gotta find a solution.
The employer is the largest payer in the state, if you will, for healthcare services, and it comes out of your paycheck as part of your contributions to the benefit, and the employer's paying nearly 100% for the employees, and of course employees are adding to that to pay for additional family coverage. So what's happened, and I want to tie in a few of the comments that you've heard, is that the employer-based coverage in the state is paying at levels much higher than the federal government and Medicare and the state and Medicaid. And so that using some of the numbers that were reflected by Mr. Myers earlier, when he talked about hospitals being paying 92% of cost, as an example. And he also said that Medicare was paying 79 and Medicaid 80%. Well, if you do your math, if your average is 92, that means that the employer community coverage, the commercial coverage that's paying hospitals, that we're paying somewhere between, according to Mr. Meyer's studies, between 117 and 120% of cost. That means that the benefits used and services used by the private sector, their cost is being covered, and the hospitals have a margin, and that margin from the private sector goes to cover the government shortfall. And so in the debate that you'll hear about, and will continue to hear about, is that the private sector, primarily the employers in the state of Hawaii, is basically subsidizing the government. And then you get into that sort of loop that Jerry Gill was talking about, that everybody's bumping into everybody as you go around, that he has a collective bargaining issue and so forth and so forth. It's the private sectors picking up the slack for the government as their shortfall. We provided care for employers, we provided for Medicare, and we provided for Quest Medicaid members. And also as a delivery system, we also provide care for people that have no insurance. So I guess I bring all this up in trying to explain that depending on who you are and what your own individual situation is, what you might think of Kaiser Permanente could be dramatically different from someone else. If you're a member and you've been to our hospital, you would see it from a patient perspective. If you're an employer, you might look at us as an insurer. All that said, this year is our 50th anniversary in the state. You're going to see some interesting things over the next 10 to 12 months from us, things you haven't seen before. But all this is being done because we've been here for 50 years, and we look forward to 50 years and far more than that of providing health care to folks that here in Hawaii.
Basically, we focus on taking care of low-income people in the community. We do Quest Healthcare. We focus on taking care of the underserved population. We also do Medicare coverage. As has been indicated to you earlier today, both in the Medicaid program and in the Medicare program, those are government payers. They tend to pay at a lower level than is found in this community or other communities as far as reimbursements are concerned. I think one of the things also I wanted to share is that a lot of the issues that you've heard about today are not unique to Hawaii. Access to care, availability of care, cost of care, who's paying what to whom and when, are all issues, not only for Hawaii, but in all other states.